Everyone is aware that the incidence of complex rhythm problems is increasing in the Western world. In the US alone, we know that by 2050 there will be 12 million people suffering from atrial fibrillation. For this reason, there's been a lot of interest in developing technologies to help us deliver therapy to these patients more precisely and safely. So one of the solutions to the problem of atrial fibrillation and its complexity is to firstly allow the operator to have the maximum amount of comfort and safety, i.e. not standing by the bed with heavy lead aprons on being exposed to radiation, but the opportunity to sit down very close to the screens of the imaging systems and the electrical systems so that you can see very easily what's going on without relying on a technician or a physiologist or a nurse to help you do that. The second is to try and make sure that the lesions that you deliver are accurate and safe with sufficient contact. And in this situation, having a stable catheter guided by robotic sheaths with force sensing, I think, is a combination that's very difficult to beat at the moment. So the combination of Hansen robotic sheaths and smart touch force sensing are a combination that's very difficult to beat because they eliminate two of the main problems within AF ablation, i.e. manual inaccuracy, because one is moving catheters around by simply deflecting and twisting the catheter, whereas the Hansen robotic sheath has a much greater variety and range of movement, and you can dial in the movement very accurately using the joystick rather than having to use a rather crude deflection handle on the catheter itself. The second is that you can't really feel the tip of the catheter by hand. You can't feel whether it really is in contact. So you're using a number of other bits of information like the position on X-ray, the position on the geometry, and the way that the catheter moves when you move it to judge whether it is in contact or not. So accurate force sensing makes a huge difference. We are still, of course, vulnerable to the fact that we may not stay in that position long enough, either because of impatience or respiratory movement or patient movement. But many of the other factors involved in this, i.e. manual inaccuracy and inability to sense the force, have been removed by these two technologies.